Hi everyone, today I'm going to do a very interesting video and this is about pros and cons of GP training in the UK. General practice is undoubtedly one of the most interesting and one of the most famous specialties in the UK. Definitely one of the most asked questions from the doctors who are planning to enter into GP training is that what are the pros and cons, what are the advantages of becoming a GP, what are the downsides of becoming a GP, and that is basically why I thought to do this video. But keep in mind that I am not a GP yet, I am a GP trainee, and this is basically my opinion and basically what I think are the advantages and disadvantages of becoming a general practitioner in the UK. For people who do not have a clear understanding of what is general practice in the UK like, I'm just going to brief you because it is very different to what it is in my country. So in the UK, everyone is registered with their GP, and basically before they reach to the point of hospital, they must first approach their general practitioner, unless it is a very urgent situation or it is out of hours where they have access to their emergency department. So every minute medical problems, coughs, colds, and chest infections, gastroenteritis, all those things will be managed by the general practitioner in the community, and GPs will be recognizing all the serious medical problems, like things like potential malignancies, or maybe if they have a chronic disease, they will be recognized by the GP, and to a certain extent things like diabetes, hypertension, angina, GPs will manage them in the community, and then they will be referred to secondary care for further investigations and also for further management. So these people will be referred and managed in the secondary care. Those who develop further complications and get admitted to secondary care, they will be discharged back to the community, back to their GPs. Post discharge care also done by the GP, and their medications, if they have started new medications, all the interactions, all the side effects of the medications will be managed by the GPs. And there are certain groups of people who are managing by the secondary care consultants in their clinics. So these people, sometimes there will be a thing called shared care. So GP as well as the specialist consultant will manage the patient together. Like for example, they will be prescribing something a GP cannot prescribe in the clinic, and the rest of the management of that medication or complications will be done by the GP, but will have access to the secondary care specialist. So this is like basically the range of things that GPs do. So most of the time there is a misunderstanding that okay, GPs just do like coughs and colds or chest infections, simple fevers, but it's not like that. A GP in the UK does a lot. That is why it has become a specialty. So general practitioners are also known as specialist in family medicine, or consultant in primary care, or consultant in family medicine. There is a recognized training program to become a GP in the UK. Okay, so what are the advantages and disadvantages of becoming a GP in the UK? I will first go through the advantages. Most important pros, I think, of becoming a GP is the flexible working hours. Once you have completed your training and become a GP, you have complete freedom of choosing your working hours. Like as a normal working doctor, you might choose to work 4 long working days, or you might decide that I only want to work in the morning hours. So you might choose to work only in the mornings, or you might choose to work like 1 or 2 days a week. Maybe someone might think, okay, I don't want to work during weekdays, I have some other things to do, I only want to work in the weekends, like out of our GP. So you have this full flexibility of choosing your own working hours and arranging your work week the way you want to. So that is one of the biggest advantages. I don't think any other specialty will give you that much of flexibility to choose your working hours. The second biggest advantage, I think, is the freedom you get, or the opportunity you get to mold your future career as well as your life the way you want to. Basically, if you are someone who like family medicine or who like general practice a lot, but you also love cardiology or say gynecology, or you love dermatology, then you can become a GP SI or GP with special interest in whatever the specialty you like. I know GPs who can do echocardiograms, who work as a GPSI in cardiology, and their GPSI dermatology. There are a lot of GPs doing that. You can basically become a GP with a special interest in any specialty you like. Some GPs choose to work as a GP in the community for 1 to 2 days a week, and rest of their week they will be working in a specialist clinic as a GPSI in another specialty. Not only that, you can even pursue your non-medical career goals as well. There are portfolio GPs who are doing full-time medical education. There are even GPs who are also international yoga instructors, and there are GPs who are doing sports medicine. Basically, if you want to start your own business, you have freedom to do that. You can basically do anything you want alongside your career as a GP. Talking about flexibility of choosing or molding your career, I am someone, I love women's health, and also I love to do small procedures like small surgeries, and also things like joint injections and all. So I don't think there's any other specialty that give me the opportunity to do all those things in one specialty. Other advantage I think GPs get is the range of medicine they get to practice on daily basis. So you can basically see a neonate or a pregnant mother and maybe an elderly patient in the same day in the same clinic. So that kind of range of medicine you are practicing on daily basis. I think there is no other specialty that gives you that opportunity. So personally, I think that is an advantage. So next thing I like about general practice, or I think I see as a pros, is the continuity of care you get to provide for patients. Basically, you might see a patient in their first presentation, and you might diagnose them and refer them for secondary care, and they will be discharged back to you. And from that time onwards, for the rest of their disease progression, you will be the one who will be following up these patients. To be able to provide that continuity of care is a big advantage a doctor can get, because that gives you a great satisfaction, as well as that gives you a great opportunity to learn along the way as well. Other thing is the ability you get to practice preventive medicine, because I personally think, again, this is a huge advantage GPs get nowadays in modern GP practice in the UK. You get access to dietitians, health and well-being coaches, and you get access to this social prescribers, and you can do a lot in terms of preventive medicine. I love the patients coming to me and say that they want to lose weight and get healthy, and I love to refer them to my health and well-being coach or dietitian, and then follow them up with their progress. So this is another advantage you get as a doctor. So other thing is disadvantages of working as a GP in the UK. Disadvantages I have listed based on the things I have seen or things I have heard. I can get really biased as well, because I love GP training and I chose to become a GP, so I might not see the real disadvantages someone else from outside see. So you have to bear that also in mind. Anyway, first disadvantage is isolation. A lot of people think that working as a GP is really boring and you work in your own closed room and you can get really isolated when you're working. It's not like working in a hospital, like open ward with your team of doctors and nurses and all the other multidisciplinary team. But I don't think this is correct, because nowadays the modern GP practice is changed a lot. Personally, where I work with a lot of other GPs, as well as I work with a huge team of people. We have advanced nurse practitioners, we have nurse consultant, a paramedic, we have a health and well-being coach, a dietitian, healthcare assistants. We also have practice managers, secretaries, and telephone operators, receptionists. So it's like a huge team we are working. And also in our practice we all get our coffee break at the same time, because we can get together, and there are a lot of meetings happening on weekly basis. Like, it's not that isolated as people might think from outside. Next is dealing with uncertainty. Yes, that is true. The GPs in the UK or anywhere in the world, they deal with a lot of uncertainties, because you don't have access to blood tests or other investigations like chest x-rays or CT scans instantly like a hospital doctor do. So GPs have to rely a lot on their clinical history taking skills and examination skills, which can be a disadvantage. But when you are going through your GP training, you learn a lot how to deal with uncertainties, and also you have the liberty of bringing your patients back. And nowadays there are a lot of telephone consultations happening, video call, you can take video calls, patients can send you pictures via secured lines, so you have ability to follow up your patient once your results are back. So it has become a little bit easier nowadays, but it's certainly a disadvantage that you have to deal with a lot of uncertainties and you don't have access to investigations instantly as a hospital doctor do. And the other thing is time pressure. Yes, I have heard that GPs in the UK are under a lot of pressure, and most of them do 10-minute consultations, and it's not enough time to deal with a complex patient especially, and you will end up having a lot of backlog of your admin work in the end of the day, so you rarely get to finish your shift on time. So this is a huge pressure GPs in the UK face, but personally I think this is a choice, because you have that freedom of choosing your working schedule and working environment. If you choose to work all the 5 days a week, maybe you want to earn more, or maybe you have to work, or you like to work, and you choose to work all 5 days a week, and then you end up having a lot of admin work. So that is basically a choice, I think, and also it depends on the place you are working, the demography of your GP practice, because if it is a very condensedly populated area, yes, you can get really busy and your patient load is a lot. The other disadvantage I hear a lot about is that GPs lose their clinical skills over time, and they get really blunted over time. I don't think this is true, because GPs, I think, really get their clinical skills polished over time, because you have to rely on your history and you have to rely on your examination skills. So over time GPs develop this skill a lot. I have seen senior GPs who are really good at delivering that patient care even without investigations. So I really don't think as a doctor a GP lose their clinical skills. Yes, if you are talking about procedural skills, you rarely get to do a blood test or do a procedure on a patient. Someone can see this as a disadvantage of becoming working as a GP. So those are all the pros and cons I could come up with, but definitely people will have different opinions. So if you have things to add on to my list, please feel free to comment below. I am really happy to know your opinion as well, and also if you don't agree with me, just let me know that as well, and that's also interesting to know. And yeah, I hope you have enjoyed this video, and I'll see you again with another video. Bye.